Hello, everyone. My name is Isaac. I'm the CEO of Leaa, and I'm here to introduce you guys Leaa, which is a new healthcare that's designed for you. So Leaa started out about 4 years ago when I was sitting in the emergency room and I was treating patients for, sore throats, ear pain, injuries, and basic medical care. And I realized that waiting 4 hours in the emergency room and being seen for 5 or 10 minutes in a emergency room, private patient room, and getting the patient out wasn't really the definition of care. And then I moved on to working in the urgent care, and I was seeing patients, waiting about an hour to be seen for the same exact thing. And most of the time, these patients would come back 3 to 7 days later with another problem. I would see a patient with ankle pain coming back with the flu because the guy he was sitting next to was coughing in the waiting room, and gave him a little gift before he left. Second issue I was seeing is that these patients were coming back and calling us highway robbers because they were getting bills and they weren't aware that they had such high deductibles on their insurance plans and were being hit with these secret bills that they were not expecting. So I came up with an idea where, we will come to your house, we'll deliver healthcare to you, we'll take technology into it, and it'll all be done in the comfort of your home. We get to you within 1 to 2 hours, and we bring everything to your door. Some of the stuff that we do, is on this list, but we go from urgent care all the way to cosmetics and fillers. We have nutritionists that can help with your lifestyle. We do COVID vaccines, regular vaccines for school, travel vaccines. We even do x-rays, sonograms, and blood work in the comfort of your home. Leaa is delivering care by making healthcare simple. All you need to do is either go on our website, go into a chat, go on our chat bot, go into our app, and order a medical provider. Once you make that order, the provider gets to your house within 1 to 2 hours or at a time that's convenient for you. So you can make a visit for 8 p.m. tonight instead of within 1 to 2 hours, because that's when you'll be home and your kids will be asleep. Leaa sends the medical provider that's licensed in your state to your door. They come with everything in their bag. They can do rapid tests, injections, IVs. They can even take your blood and run it on the spot and give you results within 2 minutes for certain tests. And if patients need x-rays or sonograms, we can do that at your door as well. The one beautiful thing about Leaa is that all the prices are online. You know exactly what you're paying for. You get no surprise bills at the end of the visit, and everybody's happy. When you book a visit and you know that it costs $150 for a visit or $250, and doing an x-ray and a strep test or a flu test will cost X amount of dollars, and you know that at the end of the day, you're going to be paying $1,200 and you paid before we leave, you're very happy with that instead of getting a bill 3 weeks later that you weren't unexpecting. Now, we have providers that work for Leaa. We have about 60 providers currently, and we're growing our team. People always ask, why would a medical provider work for Leaa? Well, one of the reasons is because you have a better lifestyle. Medical providers on average are burnt out. We work, 40 to 60 hours a week. We get paid on average, an hourly rate of about $90 to $100 an hour. So we're making about $900 capped a day. We see 60 to 150 patients, and these patients are nonstop, demanding, wanting to be seen now. And, we work for 12 hours and have to chart all these patients that we saw. In our medical model, our providers work about 20 hours a week. They make up to $2,000 to $3,000 a day, depending on how many patients they see and how much services they do for the patients. They see about 7 to 15 patients a day, and they work about 6 hours, and there's no heavy charting necessary. Another beautiful thing about Leaa is that we have, a very, very transparent cost analysis. When a person goes to an ER, right, they get hurt. When a person gets hurt at home or hurts his knee, let's say, and he needs to go and get an x-ray or get treatment, he has two options. Either he goes to the emergency room or he stays at home and he waits for his problem to resolve, which is something I wouldn't recommend. There's a third option, using Leaa. With the first option, the patient goes to the ER. A lot of times they take an ambulance. That costs about $500 to $1,000. Second, they wait about 6 to 8 hours in a waiting room, in pain, yelling and screaming with another 50 people there for the same problem. After that, they get a bill for anywhere from $3,000 to $5,000. And sometimes they even get a cherry on top. They come back with the flu or COVID 5 to 10 days later. With Leaa, you spend $150 for your initial exam. We come to your house within 1 to 2 hours. So there's no wait in an emergency room filled with sick people. We get the X-ray in your house for about $300 to $500, and we cast you for $350. At the end of the day, you spend $800 to $1,000, and the visit is over. Leaa is currently in a few markets. We're currently in New York, in New Jersey, Houston, Texas, Dallas, Texas, and Miami, Florida. There are other ways that you can use Leaa. Leaa has its own insurance health plans where you can sign up for a membership and join our plan. With this membership, you can get visits and get seen in the comfort of your home 2 times a month for free without paying anything extra, and you get priority care. Other ways you can use Leaa is in the US, we have something called FSA and HSA accounts. These FSA accounts are pre-tax dollars that are put away into your account that you can use for health expenses. So Leaa's house calls count as a health expense. So we have about $3,000 a year we can put away that we can use for these type of services that's tax-free. Leaa is planning on expanding to more markets. We're planning on making our services available to large cities all over the United States and also in other countries. The way we're going to do that is by introducing our app and getting more providers on board with the company and being able to really launch this to a place where a lot of patients are able to be seen in the comfort of their home and changing the landscape of healthcare. Our patients love us. We have over 3,000 trusted patients. We have a 4.9 rating on Google, all verified reviews with patients that are, were head to toe for us because of the services we provide. The other good thing about Leaa is that when patients are seen by us, they tend to use us consistently. It's like going to a restaurant you like. You eat the burger or you eat a steak there. You're like, oh, I like this place, and you continue to use it. This is the same idea. We have a lot of customers that, they use us once for their mothers, their grandparents, their sisters, their brothers, their children. And the experience is so easy and so, without any headaches. Providers there, everything is ready there. We don't have to go get you the medication you need. It's with us and treating you at the comfort of your home and having you diagnosed and treated, at that visit, which is amazing, without anybody waiting and knocking on your door, asking you to get out to see another patient waiting for you. That's critical. We also have celebrities that endorse this as well. There's a lot more that we're, more than this, but this is just some of the big names out there. Leaa also has a lot of corporate clients. We see clients like SoftBank, Target, Nike, and we do testing for them with COVID. We do a lot of physicals for their new talents and treatment as well in their hotel rooms or homes when they're out in the areas that we're covering. Our team currently consists of myself, Isaac Yakovov. I'm a PA by trade. I've practiced in emergency medicine and neurosurgery for the past 8 years. And I took the knowledge that I've had in those 2 fields and I brought it on to Leaa and have been expanding the companies ever since. A co-founder of the company is Eli Ofel. He's from Israel. He has a lot of background in Google marketing and software engineering. And what he does for us, he takes care of a lot of VIP clients and patients in that side of the city, and has been practicing medicine for over 20 years and has been an advisor for a lot of different companies in the similar space. Some of our other directors are Jeffrey Hogan. He has a lot of healthcare experience in insurance models and large system healthcare, and Mark Lawson as well.